Thank you very much, Mr. President. I wish to stand to give my support to this motion for the borrowing of 13,500,000 euros for the health sector in this country. And Mr. President, I think information has been put forward in terms of what the monies will be used for. Emergency operating expenses in the health sector related to COVID-19, as it pertains to vaccines, as it pertains to medium to long-term post-COVID health instruments. Mr. President, I am happy to hear that the leader of the opposition business here supports the motion for borrowing. However, it's always seemed to come across that we are playing politics and we are leaving people in the dark. Mr. President, I think the Minister for Health explained in the lower house, and I think also the leader of government business gave explanations as to what is being purchased, what is on the respiratory units, the chairs for the dialysis unit, to strengthen intensive care unit, the capacity for patients who have respiratory diseases, the lab capacity for testing. Information is being given, the update of the IT and other equipment and software, stockpiling of medical equipment and medicines, providing for vaccine support and logistics. Mr. President, we recall Rock Hard Cement getting $8 million for vaccines, where we had a COVAX facility providing vaccines through the WHO and PAHO. And this former government, this former administration gave out $8 million. We've only gotten back $2 million, and our monies are out there. And when we intend to borrow to deal with vaccine situation and other logistics, we are being told we're playing politics. We are giving information. We want to strengthen transport and surveillance. When we came into government, Mr. President, I'm sure you recall, the Minister for Health stood up in the lower house and gave a range of updates in terms of what was done at the facility. And I may add, Mr. President, COVID even saved us our OKU hospital, which was complete, ready to be transitioned into, but being held back. And thank God, COVID forced us to rush into OKU. Otherwise, at the mercy of Health City Cayman, we would have been today. But we had no choice but to get out of Victoria Hospital and go into OKEU and give the people of St. Lucia what was negotiated in the EU for them, which is a first-class health facility in the OKEU. And so even when the Victoria Hospital was transformed into the respiratory clinic, there is much to be done. And I agree the former administration had to spend money to improve the services, but they did a whole lot of painting on the outside. But we saw the patients themselves posting videos of what was happening, the terror that they experienced at the hospital. And so this government had to find money to improve the services, to deal with even things like Wi-Fi, so that the patients could speak to their loved ones and the doctors. And after borrowing hundreds of millions of dollars for health, for COVID, then we saw them doing the telephone fundraiser so that they could buy protective equipment for frontline workers. What is that? Borrowing millions of dollars for COVID, and then frontline workers had to be doing a telephone, calling people to give money so that they could buy protective equipment for frontline workers. So when we are about playing politics, I like, Mr. President, I like us to just be educated. I like us just to be open. I like has to deal with the business of this country and tell the people what is. Just like they did previously, if you have 1-2 questions, be specific. Ask your 1-2 questions. The leader of government business, myself or any other senator, could rise and give guidance. But to play and to go back and forth in this noise and always like this is a political game. I repeat, Mr. President, this is not a political game. These are trying times for the people of this country. And so, the government has no choice. Even if they wanted to play politics, they have no choice but to do what is absolutely necessary to strengthen the healthcare system. As the leader of government business indicated, many of our people who passed, and may they rest in peace, and their families continue to be strengthened because they have lost loved ones. A lot of them had underlying conditions. Many others would not take the vaccine because they are too scared to do so. But we look at the situation, underlying conditions, and so we must not throw our hands in the air and say we can't do anything. We must do what is absolutely necessary to strengthen the healthcare system, the primary healthcare system in the health centers, to do what is absolutely necessary so people can have health and wellness. They can do the early testing. They can go to the doctors in the health centers in the communities and get their medication. This is why we're doing what we're doing. And so yes, we want to strengthen all the logistics. We want to strengthen the systems in our health sector to respond, and as we continue to get out of COVID, to respond to the COVID situation. We want to address the gaps in the public healthcare system. We want to do all what is necessary to continue to save lives. And so, Mr. President, I again reiterate my support for this motion of borrowing on behalf of the people of St. Lucia in strengthening our healthcare system. I thank you.